Okay, I was talking about the tip sealing. My recording was cut up. Sorry about that. So as you can see from the picture, so the flame is kind of almost melting this long neck of the ampule, and then these metal kind of pieces are pinching it, grabbing it, and it's gonna pull it out. So that's what tip sealing is. Okay, so it's gonna describe in the next page. Yeah, ampule is rotated in the flame. So it's going to almost melt it by doing so on a single burner. Then glass is very softened because of the heat, and then tip is grabbed firmly with the metal pinching device and pulled quickly away from the body of the ampule where the drug is located. So which continues to rotate. So it's continuously rotating. The small capillary tube is thus formed, is twisted and closed. So the glass part is giving you kind of concealed neck. Okay, so that's it's a pull sealing, tip sealing, but it surely gives the surer sealing. There's no leakage because it doesn't require any stopper or seal. So it's a very cheap, although it's a slow process, but it's a very cheap, I guess, and very effective sealing process. That's what it means. So understand ampule sealing process. Okay, and then if you're using vials and bottles, they will require additional part, which are the rubber stoppers. Okay, so the sealing will take place in the almost same environment as the filling process. So you require that very clean area where HEPA filtered air is coming down as laminar flow. It makes sense. Let's see, the closure stopper should be inserted appropriately. So that's normally an automated process with high speed. You've seen that video at the beginning, right? So it's talking about that. So yeah, read over this part. And then when small lots, especially like a clinical trial phase 1, you're only manufacturing very small lot, and then the automated machine cannot handle it because the automated machine normally generates a lot of large batch, right? So then you may have to do a manual filling, manual stoppering, manual sealing. Then people may do that with their hands. Okay, then you're going to do the lab on this one, but as you did in the lab, you may have to use forceps that can grab the stoppers, right? But it's not really desirable because it can create a greater risk of contamination, but you have to use your best aseptic technique to handle that process. Okay, so it's a normally good test for evaluating aseptic operators' aseptic skill technique, but is not recommended for any product filling and stoppering. But you may have to. Okay, if it's a very small batch size you have to manufacture. Okay, and read over that. The requirement that sealing of the vial and other containers be accomplished in the cleanest environment you have. So class 100 grade A ISO 5 clean the mail area. Makes sense, right? Okay, then okay, the sealing after rubber stopper is placed, then you're gonna place the aluminum cap, and then that is a sealing off. So we're talking about that part, right? It's a sealing process. Okay, so we call that a crimping or crimp. It's kind of interchangeable, seal, aluminum seal, or aluminum crimp, and we call the process crimping process. Okay, so normally this provides extra layer of protection, sealing on your container, as well as a means of, it's going to work as a mean of tamper-proof evidence, tamper-proof. So if any tampering happened on this container, it'll be obvious because they have to remove this the integrity of this sealing to tamper this. Then it'll be obvious. So that's why it's used as tamper-proof evidence. Okay, because in the history of U.S. drug market, there was some tampering incidents like Tylenol bottles or tempered. I don't know when that year was. Maybe it was in 1980s or something. People tempered the Tylenol bottles, over-the-counter drugs at some drugstores, and they put some toxic substances, cyanides there, so some people died. So because of that, a lot of drug manufacturers come up with some tamper-proof packaging material from that time on. Okay, so another layer of consumer protection, of course. So aluminum caps are designed that outer layer of double layered cap. So the center of the single layered cap can be removed to expose the center of the rubber closure without disturbing the band that holds the closure in the container. So you'll get to see that when you do the lab. So this aluminum layer, right, the seal, in the middle of it there's a plastic pot. So you can get rid of that, remove the plastic pot, and you can put your syringe directly into it without removing the aluminum seal or without removing stopper. You can just stick your needle through the aluminum stopper. That's normally how you take up your drug doses through your syringe. Okay, so that's that. So assignment question finally. So what are the 4 major mechanisms used in drug filling operation? So we talked about gravity filling, right? That's one of them, and the piston pump operation, and then peristaltic pump. And the last thing was what? Probably it's the solid filling using some kind of screw system, right? Auger generated. Okay. And then under what clean room environment does the filling operation take place? That should be the cleanest environment, grade A, or ISO 5, or what is the federal standard 100, ISO 100, right? And then what are some of the major issues or problems that may occur in the filling of solid? We talked about all those challenges, homogeneous dosage, and then particulate issues, and contamination issue, all those things. So here they are, all these things, accurate dosage and content uniformity, environmental humidity control, aseptic condition control, particulate matter issues, all those issues are there, right? And then what are some of the major issues, problems that may occur in the filling dispersed system, including what? Suspension drops. So it's probably right there, right? Main issues are what again? Those homogeneity, of course, because particles are floating, they may be settling down. It's hard to get them well suspended and get that equal dosage. And validation of those homogeneity, it's hard, especially your solvent is very viscous. Clogging problem, of course, in the filling needle area. Batch size, aseptic formulation is hard to do. Batch size, you cannot come up with small batch. And particle size reduction, because particles are there. And then what else? Under what cleaning environment does the stoppering operation take place? It's the same cleaning environment as the filling. Filling, stoppering, they both happen in the cleanest environment, right? And what are some of the major issues or problems that may occur during the stoppering operation? Right here they are. So these are the major problems you can encounter during your stoppering operation. So maybe too little or too much silicone on your stoppers, because silicone is needed as a lubricant, but you don't have too much or too little. And misalignment or bending of syringe stoppers could cause major defect, leakage, and stoppers become jammed on the track. It's not going to be placed in the right spot. Improper headspace, if you are dealing with the syringe filling, and stoppers are not completely seated, again, it's going to create leakage. So those are all major defect possibilities you don't want to have in your drug sealing operation. And then finally, what are the 2 major methods used in ampule sealing operation? So we're talking about the tip sealing, pool sealing. Probably that's what those are. So see, tip seals and then pool seals are those 2 methods. Okay. Alright, so that's it for lecture 10. Thank you so much.